Today we're going to have Supervisor Fletcher provide us an update on the informational charts and graphs, and then Dr. Wooten will give us a medical update, and then we'll go right to the questions. But before we do, I wanted to go over a few things. We are continuing to record positive cases in our region, and that tells us our long fight is not yet over. Because of that, we need to continue holding the line to stop the spread. I know you're frustrated. I know this has been tough on workers who've been laid off due to the virus. This has been tough on small businesses, some that may never reopen again. This has been tough on kids who cannot go to school and see their friends. And this certainly has been tough on families trying to remain positive in this time of uncertainty. I'm frustrated too, and would like to return to our normal lives. The easiest thing would be to blame others or say that the rules don't affect me. But we cannot let this virus divide us. We've got to remain united. I've been on the Board of Supervisors now for a little over 25 years, and before that I had the honor and pleasure of serving as a mayor and council member in the city of Chula Vista. So I've seen a lot of bad times, wildfires, economic upheavals, earthquakes. Those moments of crisis eventually came and went. I cannot promise you this will end soon, but I can say that I've never seen another time in our region's history where the community has come together for so long. Let's keep that going. Let's stay united. Our unity is certainly our strength. As the saying goes, united we stand, divided we fall. As I said, this virus has spread throughout the region and has impacted everyone. But one of the areas of particular concern is the high number of cases with our neighbor in Mexico and their potential impact to residents of South County and beyond. I'm a Chula Vista boy, grew up there, lived there my entire life and raised my family there. So believe me when I say that we are taking the situation seriously, we are. Now, we don't have a clear definitive reason for why, there are so many cases in South County. We do know a small percentage is from people traveling across from one of the busiest land border crossings in the world. We also know that there are a lot of cases at the Federal Detention Center in Otay Mesa, and we know that South County is densely populated and is home to a lot of essential workers who travel to work and return to their homes at the end of the day. But we are taking steps. Our medical experts have been working with a task force to look at this issue. This is a novel virus, and scientists are still learning much about the virus and how it infects people. Meanwhile, our county has asked federal authorities to do more screening of travelers from Mexico into the United States, and you'll hear more about that in just a little bit. We're reaching out to different levels of government because even if a small number of cases are coming from the border, it's a concern and we must do more to control it. On Monday, we are opening additional permanent testing sites in the region, including the city of Chula Vista and the city of Escondido. Now, these sites are not sites where just anyone can drive up or walk up to take a test. Testing is by appointment only, and for people who have met the criteria for testing and have been referred there by their medical providers or by the county. In addition, we are planning to offer mobile testing where we will send large vehicles to areas of the region where we know there is a need for more testing. We hope to roll that out very soon. And individually, the cities of Chula Vista and National City have taken steps to slow the spread of the virus by mandating facial coverings in public. I commend them for doing so. With all that said, it's important to remember that this virus does not respect international borders. It also doesn't respect city lines or area zip codes. So where a person gets infected may be different from where the person lives or where they eventually get hospitalized. That's why, our public health order don't specify that only people in a particular city must maintain space or wash their hands or cover their face. Everyone needs to do that. We all have to be in this fight, whether we live in Chula Vista or Oceanside. That's the way we have to work together to beat this virus. So thank you, San Diego, for continuing your fight. And now we'll go right to Supervisor Fletcher.
Thank you, and good afternoon. I have a number of important updates for you today, and so I ask that you bear with me as we work our way through these. First off, today we will be modifying our public health order to open up access to the beach, the ocean, effective sunrise on Monday for swimming, surfing, paddleboarding, and kayaking. We believe that we can take this step and this action in a way that does not compromise our efforts to protect public health, but we need the public's health to ensure compliance. We need the public's health to exercise the appropriate restraint. We certainly understand the special importance the ocean has to our community, to our society, to our way of life. It's where we swim, surf, and recreate. The ocean is a symbol of who we are as San Diegans, and it is appropriate at this point that we open up limited access to the ocean as a step in our continued progress in dealing with the challenges in front of us. But to be clear, our public health order removes restrictions on people entering the water for purposes of swimming, surfing, kayaking, paddleboarding. Local cities are responsible for opening up the beach access, and it will be upon each and every one of them to determine if they want to open up the beaches on Monday morning or not, or when they choose to do it. It is their discretion, the hours, along with any additional restrictions that they wish to impose. Cities have the authority to be more restrictive, but not less restrictive. Some cities may do it right away, and some may choose to wait. So before you head out to your local beach on Monday, I would encourage you to check with your local city to determine if they will be open, staffed, and ready, or if it will come at a later date. I want to say a special appreciation and thank you to the coastal mayors and lifeguards who came together and worked together on a plan for how we could responsibly open up access to the water. As we look to ease protections, this is a great example of how we can do it. Collaboratively, working together with one regional standard. Again, we're very grateful for each of the coastal cities and the lifeguards who developed a plan and who are also responsible for ensuring full compliance with this plan. Their plan included provisions for increased staffing for observation, education, safety, and of course, enforcement. We also appreciate and respect the decision by the coastal mayors and lifeguards to include in their plans that piers and boardwalks will remain closed. The only substantive change from their recommended draft is that we did not include recreational boating in Phase 1. We believe it is more appropriate to consider in a Phase 2, which we are not yet at. The simple reality is that it is very difficult to ensure physical distancing on a boat. It is also almost impossible to enforce that it is limited to household gatherings. We know that this is important to a lot of people in San Diego, to the opportunity to recreationally boat, and we do plan to include it in the next phase and step at such time that the conditions on the ground warrant that be possible. But boating is not included in the actions that will be in effect for Monday. Our actions also do not impact state beaches and state parks. State beaches and state parks are at the sole discretion of the state of California, and they will make announcements about their posture at their choosing. To be clear, the existing restrictions on parks and beaches do remain in effect as it relates to parking lots. Parking lots at beaches will remain closed. Restrictions on active recreation also remain in effect. This means that you can go to the beach if your jurisdiction opens it on Monday morning, and you can walk, you can run, you can traverse across the beach in order to enter the water, but you cannot sit, lay down, play volleyball, engage in group activities. These are things that can be considered in Phase 2, but initially it will be limited to simply running, walking across the beach, or traversing across to enter the water and then exit. And I want to make an important point here that it really is important. Everything that we've done throughout the duration of this crisis has been out of an attempt to protect public health. It's not out of a desire to restrict our way of life or to limit individuals' choices. It's based out of the simple fact that we are taking action to try and preserve and protect life. As we begin to see some easings of some of these restrictions, it is important that we all work together with each other to exercise restraint, to act responsibly, to look out for one another, because the worst thing in the world would be is if we had to turn backwards. And so it is important that we move forward together as a community and not backwards. And so we are asking, as we take what is a reasonable and appropriate step at this point, that we ensure that we do that responsibly. Our responsible actions will yield continued progress on the state and federal metrics we need in order to see continued progress towards opening. And so we ask the public to please join one another, join with all of us. Let's make the job of the lifeguards and the law enforcement officers and the city officials much easier. Ensure physical distancing. Cover your face when applicable. Please do not violate the spirit or intent of the public health orders, and responsibly enjoy getting back in the ocean starting Monday morning. We are also announcing today that we will be issuing a countywide public health order requiring face coverings throughout San Diego County whenever you are within 6 feet of a non-household member. It was some time ago we issued a directive with a strong recommendation, a strong encouragement to have face coverings, and when you leave your house. We believe that there is increased evidence that this is not only helpful, but perhaps just as importantly, we believe this is going to be a part of life in the new normal. Until such time as we have a vaccine or a widely available therapeutic drug, there are going to be parts of life that are going to change. And getting in the habit of having a face covering when you leave your house, that's going to be part of the change. A number of individual cities have made the choice to mandate them in their jurisdictions, and while we respected those decisions when they made them, we believe we are now at the point where it is most appropriate to have a consistent approach throughout San Diego County. And so we will be issuing a public health directive requiring face coverings when you leave your house, when you come within 6 feet of a non-household member. We want to be respectful of giving folks a little bit of time to comply, so the effective date of enforcement of this will be May 1st, but we would like to see widespread adherence begin now. On Monday, we asked local jurisdictions to begin planning the process for parks. Local jurisdictions have the opportunity to open them if they choose, but we do have a number of countywide restrictions that remain in effect. Restrictions around parking, restrictions around the type of activities that can go on. And as we begin to move into consideration for the next phases, we're reiterating our call today to ask local jurisdictions to complete a park assessment plan. It is basically showing how they will comply with various requirements and various things that should be put in place, including physical distancing, staffing, sanitation, hygiene, enforcement. We are asking local jurisdictions to have those plans completed by April 28th. Our goal as a region is to be able to remove some of the restrictions around parks on May 1st, but the ability to meet that goal will in large part be determined by the ability for us to continue to show progress in limiting the spread of coronavirus. We also know that there has been a lot of interest in opening other outdoor recreational activities, golf courses, equestrian centers, things like this. We have requested clarification from the state in terms of what qualifies as essential and non-essential, and we are rating in response. But we are simultaneously asking outdoor recreational entities to complete the same planning process, to prepare and plan and put together how you would operate and under what conditions, and have that ready also by April 28th, with the hopes that we can get the clearance and assurance from the state, along with the approval of our public health experts, to possibly be in a position to open up these entities on May 1st. Later tonight on our coronavirus website, you will see a template plan for parks along with outdoor recreation activities. This is a plan that you can download, fill out your most appropriate settings, and have that ready to go in the event we are given the okay and in the event things are moving forward. Again, we want to see forward progress. We want to be able to ease back some of the things that make our life a little bit easier in these difficult times. But our ability to show continued progress on the spread of coronavirus and our ability to really responsibly move forward in these is what will determine each turn of the dial. And if we have the ability to continue to move, to ease restrictions, to provide more access and more opportunities. And so we continue to ask for your cooperation and help. The public was incredibly committed at the outset to this. And really coming together as a community, and we ask for that same level of commitment as we begin the process of looking forward. Supervisor Cox mentioned some of the concerns we have regarding the healthcare situation in Mexico. We remain in contact with the officials down there, and we have received reports that are concerning about the spread of coronavirus south of the border and the impact it is having on their healthcare system. But of course, it impacts our entire region. We have an estimated more than 200,000 U.S. citizens who live in northern Baja who routinely cross the border. This includes a fairly large number of essential workers. In response to this challenge, we have been proactively engaged with the state government, federal government, community partners, and healthcare providers. Last Sunday, we had a call with Secretary Mark Galley, the Secretary of Health and Human Services for the state of California, along with the leadership for the State Office of Emergency Services and many of our county officials and local healthcare partners, where we discussed the situation we are seeing, along with requests for their assistance. We had a follow-up call a few days later, and we remain in regular contact with the state of California. We are requesting assistance from the state of California in joining us in encouraging the Mexican authorities to adopt similar parameters in physical distancing and NPIs to match those of our region, in joining our county in joint requests to the federal government to implement health screenings, ideally temperature checks for everyone crossing the border. We think that this could be an easy way to identify anyone crossing the border who is symptomatic. If this was in place, we could implement a quarantine for anyone with symptoms pending testing. We asked them to join our county in our request to the federal government for a 14-day quarantine for any non-essential border crossings. This is consistent with the international travelers from other impacted countries that have been and I believe remain in place. We also requested from the state of California any assistance on the prioritization for personal protective equipment and healthcare capacity for San Diego County, and in particular those in the southern part of our county, and for the state to consider any options they may have to provide mutual assistance to Mexico, understanding the limitation and availability of resources and the challenges that that may pose. Our state government has been incredibly responsive, and we appreciate their attention, their cooperation, and their engagement. The state also moved quickly to fulfill additional requests we had, and this was to ensure that healthcare workers who reside in Mexico and work in the United States would have access to free motel rooms. We have shared this information with our healthcare partners to ensure that they are aware of the opportunity so that any of these essential healthcare workers do not have to cross back and forth across the border in order to go home. The state is also working on some options around personal protective equipment and other important requests. Additionally, we've engaged the federal government. Supervisor Kristen Gaspar, who has a close relationship with the Trump administration, has sent a letter to Vice President Pence, the head of the coronavirus task force, requesting help and assistance on the border, similar to many of those requests that the state is also making. We appreciate her efforts and also anything that might come from federal authorities in their efforts to help this. And finally, as a county, as Supervisor Cox mentioned, we have taken steps to increase testing in the southern part of San Diego County, both testing available to community clinics as well as the drive-through testing site in Chula Vista, Dr. Wooten announced yesterday, and the potential for mobile testing. And as hospitals see increased demand, we do adjust our personal protective equipment fulfillments as best we can to meet those. The systems with the highest number of COVID cases happen to be in South Bay hospitals. And as with all facilities, from skilled nursing to clinics to hospitals, when there's a cluster of cases, we prioritize and maximize what we can get to them in order to assist. And so we will continue to monitor this situation daily, the impact of the border, along with the significant number of cases we are seeing from the Otay Mesa detention facility that is represented in our South Bay numbers. Two additional quick things before we get to our daily charts. Yesterday, we announced a change in our public health order regarding elective medical procedures. This change was designed to allow hospitals and healthcare providers to perform non-emergent or elective procedures based on their determination of their clinical need and their supply capacity, and consistent with state guidance. Our hospitals have been incredible partners throughout this crisis. That is because of our collaborative work together. It is because of our communication, our coordination, and our joint efforts. Unfortunately, as a county, we did not adequately consult all of our hospital partners before this announcement was made. It was certainly not intentional, but on behalf of the county, I apologize to our hospital partners for this mistake. Next, I would like to share some preliminary information about a recent death in one of our public health motel rooms. An individual who had been receiving care and assistance for a suspected case of COVID had tested negative and was scheduled for transfer to the convention center. Unfortunately, yesterday, this person was found unresponsive in their motel room. The cause of the death is undetermined at this point, but there is nothing to indicate foul play. We will keep you posted on the determination on the cause of death as the medical examiner does their evaluation, and our deepest condolences and sympathies go to this individual's families and loved ones. Finally, before we get into our chart, I want to share with you that we are changing the format of how we report our daily cases. The numbers we report, positive cases, tests, deaths, hospitalizations, those numbers all remain the same, and those numbers will all be shared daily. But in an effort to align our public reporting with the current guidance on thresholds to begin reopening, on thresholds of what most effectively measures your progress as a region, primarily that of percentage of positive cases based on the number of tests conducted, along with the impact on our healthcare system, we are shifting our graphics and charts to focus on these areas. Again, the numbers are the same, and they will be shared daily. The format is the only thing that's changing. It's also important to note that this format change corresponds with the rapid rise and increase in testing. We always knew that as we did more testing, we would see more positive cases. This does not inherently by itself mean that there's wider spread. It could simply mean that there's greater awareness due to greater testing. So you will see in a minute the daily totals of positive cases and daily totals on testing reflected both in the raw numbers but also in a percentage ratio. It gives us a better indication of, as a region, as the percentage of positives as a percentage of total testing on a day-to-day basis. A few days ago, we shared with you that we had 109 cases, and that was concerning because that was a jump in positive cases on essentially the same amount of testing. Yesterday, we shared with you the single largest day we had, and we put in context that that went with a corresponding significant jump in testing, so it was not as concerning. We are aligning our charts to try and show this on a daily basis and track this trajectory. Additionally, in an effort to present you relevant and newsworthy information, the charts that we've been doing daily about personal protective equipment, outreach efforts, motel rooms, and ventilators will not be reported at this briefing. The charts will be released publicly daily so that you can see any changes, and we will publicly share any significant changes that we believe warrant a broader focus. But we want to keep these briefings as informative and relevant as possible, and so we will now be releasing those charts daily unless there is something significant to share. So with that, let's jump into our first chart of the day. It is a lot of information, and so I ask for your patience as we walk through what we are seeing on the screen here and what this means. You'll notice in the bottom right-hand portion, today we are reporting 183 positive cases. Now, it is important to keep in context that 183 positive cases is out of 3,122 tests reported. That is the single largest day of testing we have had throughout our coronavirus exercise. And that represents, you see on the top there, a 6% positive rate. 6% positive on the reporting today. If you look back to yesterday, we reported 152 cases out of 2,255. That was a 7% positive. So even though the number of cases today are greater, it is a lower percentage of the total number of tests reported. And you can look back and see various days. As you go to some of the early days of this evolution, you will see very high percentages of testing, 48%, 52%, on different days because we were doing very limited testing. We believe that this is the most effective way to communicate daily the total number of positives, the total number of tests, and what you will see there in the purple line is the rolling average of how we are doing as a region in terms of our percentage of positive tests. This rolling average of a percentage of positive tests is a trend line that has been outlined by the federal government as one that should be looked to and evaluated for consideration to put in context the numbers that we are seeing. So again, this is the new format that we will use as we move forward to report out our positive tests along with our total number of tests. The next chart you will look at is our hospitalization. In the orange line at the bottom, you will see the total number of COVID-related patients that are in our San Diego County hospital systems. In the blue line, you will see the total beds in usage. And so there you can see the impact of COVID-19 on our hospital system. The dotted green line is a general sense of hospital capacity that we have referenced and utilized previously. And so this will give us an ongoing sense of the impact of where we are relative to our total bed capacity and things that we need to take into account and consider. I am going to continue this one last chart because it shares the doubling rates, which I think is important. A number of individuals are tracking. You see the positive cases along with the doubling rate now at every 15 days, the recovered, the hospitalizations total along with the doubling date ICUs and any loss of life. With that, that concludes my section of the report, and I will now turn it over to Dr. Wilma Wooten for a Public Health Officer's report. Thank you.
Thank you, Supervisor Fletcher, and good afternoon, everyone, and thank you for attending today's briefing. Planning efforts for reopening the county are currently in place, as you've heard from Supervisor Fletcher. The county is utilizing again the federal guidelines, Opening Up America Again, and the governor's California roadmap to modify the stay-at-home order. So in the President's guidelines, I want to continue to emphasize that there are 5 metrics that we are monitoring that will these metrics will determine whether or not we open up utilizing the Phase 1 approach that's provided in the federal guidelines. So the county appears to be doing well on 3 of those. The downward trend of influenza, like illnesses within a 14-day period. Supervisor Fletcher has just talked about the downward trend of positive tests within a 14-day period. And I talked yesterday about robust testing, and I think we are getting there with that area. And today I want to talk about hospital capacity. Now, as I stated, the county appears to be meeting 3 of these 5 metrics. Detailed information about testing, I provided that yesterday, and we talked about the metrics and activities related to testing. I also just want to reemphasize that our county public health laboratory will be opening 2 additional permanent drive-through programs on Monday, April 27th, one in North County and at the North Inland Live Well San Diego Center, and one in South Region at the Public Health Center on Oxford. Appointments are only by referral from a person's provider by calling 211 and asking for the nurse triage line. So today I would like to share additional information on the metric related to local hospital capacity. So this next slide is related to hospital capacity. And now please go to the next slide. So again, Supervisor Fletcher has talked about this, but I just want to emphasize the fact, number one, we have a total civilian capacity of about 6,500 beds. And the blue and orange line represents the total number of beds occupied in our county. The orange area there is the COVID-19 cases. So of the total number of beds occupied, represented as a proportion of the total number of our bed capacity, that is about 67%. And then if you look at the total number of beds occupied, COVID-19 cases represent about 7% of that total. So this slide shows that while the overall bed capacity is staying level, the COVID-19 cases are slowly decreasing. So this is good news, and we will continue to monitor this metric closely. Now, regarding our global, national, and state statistics based on data from Johns Hopkins dashboard obtained today at approximately 12 noon. Globally, there are approximately 2.8 million positive cases, including 194,000 deaths. Nationwide, over 884 positive cases have been reported, and this includes over 50,000 deaths. Statewide, California has reported over 39,000 positive cases, which includes over 1,500 deaths. And today, for the County of San Diego, we are reporting 2,826 cases, which is 183 more cases than yesterday, as well as 102 deaths, which is 2 more deaths than reported yesterday. Of the 2 additional deaths, these include 2 females. One is in their late 40s and the other in their mid-60s. These 2 additional deaths did also have underlying medical conditions. Now, of our total number of cases reported to 2,826 cases, the age range remains the same, from 3 months of age to 100 years of age. Our percentage for the age range of 20 to 49 years of age is holding at 51%. And the gender also is holding 49% female and 51% male. And now we only have one individual that has no gender identified for them. There are 658, or 23% of the cases have been hospitalized, and of the 658, 218, or 8% of the total number, have been admitted to the ICU, but this number represents 33% of the total number of those hospitalized. And lastly, of the 102 deaths, this number represents approximately 4% of the total number of cases. Also, of the 102 deaths, 45% are female, 55% are male. And regarding the race and ethnicity, of the 102 deaths, we have data for 96% of the total number of deaths, and this is represented by 53 or 54% white, 32 or 30% Hispanic or Latino, 9 or 9% Asian, 1 or 1% American Indian, 1 or 1% Black or African American, 1 or 1% Pacific Islander, and 1 or 1% is of multiple races. Again, 4 of the 102 deaths had unknown race and ethnicity. So once again, our sincerest sympathies and condolences go out to the family members and friends of the individual deaths announced today. Regarding outbreaks in congregate and community settings, today we are reporting a cumulative total of 38 confirmed active outbreaks and 1 inactive outbreak, which means there have been no new cases within the last 14 days. These numbers, in the total number of 38 confirmed active outbreaks, includes 25 active outbreaks in congregate facilities. This includes 1 new outbreak since yesterday, representing 330 cases, and the total number of outbreaks also represent 52 deaths. We also have 13 active outbreaks in community setting locations with no new outbreaks reported, and these outbreaks represent 86 cases and 4 deaths. So again, I would like to commend the public for staying the course to stay at home, and this all helps to decrease the number of COVID-19 cases in our region. We are very sensitive to the fact that everyone is making a tremendous sacrifice, and as you heard today, we will start to dial down next week on certain activities, and we want to give you advance notice today so you can begin to prepare. Also, beginning May 1st, we will require everyone to wear a mask or a face covering, not a mask, but a face covering when in public and when within 6 feet of each other. We continue to be optimistic that the metrics we are monitoring will all trend in the right direction, but we still need your help. So thank you for all that you have done to date. Now please welcome Supervisor Cox back to the podium.
Thank you, Dr. Wooten. We'll go straight to the questions. Again, as we call up your question, if we don't identify you by name and outlet in the introduction, please do so before you ask your question.
Shannon Handy with News 8, please state your question.
Yes, hi. I'm covering the reopening of the COVID clinic. The county had ordered it shut down last week at Maricosta Community College, and I was wondering if someone could talk about that. The organizers claim they are now in compliance with the County of San Diego. Can you confirm that?
Okay, Dr. McDonald will respond.
Yes, we've addressed the issues of the COVID clinic at previous news conferences. And if you recall, when they opened their drive-through opportunity in Cardiff. We learned that they did not have the appropriate CLIA certification, which is a license that they need in order to do laboratory work. We learned that the tests that they were using were being sent to a out-of-state laboratory, and they were not in compliance with the California regulations from the laboratory field services to actually do that sort of activity. And we learned that the the antibody test that they were using was not FDA approved, was not validated the way that they said that they had validated it, and that, in fact, the information that they were providing to patients after that testing wasn't consistent with what FDA guidance was provided to inform patients how to interpret those results. So that was why we actually acted as a enforcement arm of the laboratory field services to close their activities. Since that time, they have submitted some paperwork to the state of California, and Laboratory Field Services has okayed their ability to do PCR testing in a drive-through situation because they're using an in-state laboratory for that. Again, this is really under the regulatory purview of the state. We in the county acted on behalf of local citizens to make sure that they were following the law. They are still under the obligation to follow the law, and we'll continue to monitor what they're doing. But again, what they're currently doing has been okayed by the state laboratory field services.
Thank you.
Okay, let's go to the next question.
Alexis Rivas with NBC7, please state your question.
Yes, there was more BAE Systems shipyard workers who tested positive this week for COVID-19, and the source tells us the company isn't being forthcoming in a timely manner about these new cases. So my question is, for workers of essential businesses like BAE that must keep working, how does the county enforce public health orders, and who's accountable for worker safety?
Dr. Wooten's going to respond.
I'm sorry, but I'm going to have to ask you to repeat the first part of the question again because I didn't hear you. Is this-
Sure. So
okay.
how's the county enforcing public health orders with essential workers?
And in what way with essential workers? What is the issue? I'm sorry.
So we've received several complaints. That essential workers are forced to go to work in places where they're being exposed, or I should say reportedly being exposed, to other sick workers. And they're working within 6 feet. They're not required to wear face coverings. So, I mean, how can
Okay.
you enforce that all of these businesses that say they're essential are practicing these, health safety practices?
Okay, there are a lot of different things that are included there. When we issued the order about facial coverings, we really identified 7 specific businesses for which we made that recommendation. That included grocery stores, gas stations, banks, as well as transit systems, and then convenience stores and restaurants. So those are the businesses that we made it, or we required facial coverings to occur. And then we strongly recommended it for the rest of the general population. And other businesses could make that determination as a policy for their business, but we only made it mandatory for these 7 businesses. Now, as you heard today, beginning May 1st, we will make facial coverings mandatory for everyone in the general public, and we will also revisit making it mandatory as well for other businesses. In terms of enforcement, we obviously can't be everywhere, but we want to utilize assistance of the general public. So we've provided information if a business is in a specific jurisdiction, then you can call 211 to find out what jurisdiction's phone number for non-emergent reporting of complaints about businesses in that particular jurisdiction. So that's how we try to enforce. We rely on others to help identify issues that are of concern, and then that's reported to the jurisdiction that the business resides.
So what happens after it gets reported?
Well, enforcement, the law enforcement will investigate what the situation is, and if it's obvious, obviously, it's a misdemeanor, and it's up to $1,000 fine if if there's been a violation identified.
Thank you.
Thank you.
Okay, we have one other call-in question.
John Carroll with KPBS, please state your question.
Hi there. Just wanted to know, get a reaction, probably, I'm guessing, from Supervisor Fletcher, on the motion made in the Oceanside City Council, which they passed, having to do with demanding that the county allow them say-so over when to open their businesses, et cetera. They say that they should be allowed to make that decision, that they're looking at the trends, they know what's best for them. How do you guys deal with that?
Okay, Supervisor Fletcher will respond.
Thank you. Look, we know people are frustrated. We certainly understand that. I think everyone in San Diego County is frustrated and wants to get back to what they're accustomed to in terms of a way of life. But we also know that the public health orders and the actions we've taken have saved lives. You can look at the curve in California and the curve in San Diego, and you can compare it to other states and other jurisdictions that did not do the things we did when we did them, and recognize and realize the position that we would have been in had we done it wrong. You can also look to a number of jurisdictions that came out too early, that lost their focus, that saw tremendous spikes in increase. And so to reiterate the point that if we don't come out of this the right way, based on public health, based on our capacity, based on our rate of spread, based on all of the conditions that are happening, we would significantly set back any economic recovery. The best way from an economic standpoint to come out of this is in a gradual phased approach, not based on arbitrary dates or timelines, but based on the situation we see, the advice of public health, and all of the lessons that we are learning throughout the region as we go through this. To do otherwise would be a disservice both to the individuals who would lose their lives, but it would be a disservice to the individuals who want to rebuild the economy. And so while we understand the frustration that folks may be feeling out there, the simple reality is the actions we take on loosening and turning the dial have got to be guided by science, by public health, and by data. And that is not only the requirement of the law, that is the morally responsible thing to do, both in preserving life and rebuilding our economy. It is also important to know that the actions of one jurisdiction don't just impact that jurisdiction. We are an interconnected county where people travel and people move and people go around. We also have an interconnected healthcare system. And so it would be our hope that although we certainly understand the frustration, that we would continue to seek cooperation as we all move towards the goal. And we all want the same thing. We want to open as responsibly as possible, as soon as possible, and in as smooth a way. And so we'll continue to work with all of our partners out there to achieve that aim.
Thank you.
Okay, we'll go to the text questions. The first couple of questions I know deal with cool zones, and we're going to ask Dr. Wooten to respond to those questions.
Yes, thank you, Chairman Cox. We've had several questions basically asking the same thing. Is the county setting up any emergency cool zones for seniors and low-income families during the quarantine? With pools, beaches, and libraries closed, what options do people have to beat the heat? And if you are opening any cool zones, how will social distancing and other rules be monitored?
So we will not be opening up cool zones over the weekend, but we are looking at opportunities because we understand that the heat, the temperatures are going to be much higher the middle of next week. over the weekend. What we have done is, and just also want to remind people that we have a extreme heat task force. So that task force is convened whenever we get advisories from the National Weather Services. And again, over the weekend, no cool zones will be opened, but we are looking at, particularly in the desert area, looking at how we can open up Borrego Springs Library, for instance. Usually in the past, before COVID-19, there could be anywhere from 25 to 35 individuals, say, at Borrego Springs. And actually, in past years, even more. And it really is a social gathering of sorts. Now, with COVID-19 in place, we would have to social distance individuals, maintaining the 6 feet separation. So the library, if reopened, could only accommodate about 17 individuals if we use the maximum number of about 35. So we will have to look at other avenues, other facilities for opening up next week when we have additional extreme heat.
Thank you, Dr. Wooten. I actually have a question from Taryn Mento with KPBS. The testing task force will meet for the first time on Monday, and invitations just went out to potential members yesterday. What are the names of the specific facilities so far that have agreed to participate on the task force, and which facilities have been invited but you're still waiting to hear from?
So while the official invitation, we've been talking to all of the laboratory directors at our hospitals as well as at commercial laboratories. Each of them have been surveyed to find out what are their barriers related to testing and obtaining information about true capacity of testing. So the meeting on Monday will not be the first time the laboratory directors at our local hospitals and federally qualified health centers, specifically Family Health Centers of San Diego, as well as the commercial laboratories. Those are the entities that have been invited, and we have been engaging them this entire week to gain information, and that has been through the support of the Hospital Association of San Diego and Imperial Counties.
All right, thank you, Dr. Wooten.
This next question deals with border testing, and I'm going to ask Supervisor Fletcher to respond to that.
This question is from Aaron Leathley from Politico. What response has the county had back from the federal government on the requested health checks and temperature screenings at the border, and when those might start? Secondly, could you elaborate on the type of mutual assistance the county asked the state to provide to Mexico?
Yeah, so in some initial informal conversations with CBP, they were not inclined to do the temperature checks. We believe that that is a valuable tool that would provide a valuable resource to the public health. So we have elevated that request that I referenced in the letter that was sent to the Vice President. I'm not aware of any response that has been received to date. We continue to pursue that option, both with letters that have been sent along with engaging our congressional delegation in continued efforts and work. And we hope to see some progress. In terms of mutual assistance the state of California make to Mexico, that's a very difficult request of the state of California. They are very busy trying to fulfill requests from all of the jurisdictions that are within the state of California, and so I think that they are certainly sympathetic to the concern and sympathetic to a desire to help. I will let them speak for themselves, but I would just say we made the request with an understanding that it would be a very difficult one to probably fulfill at this time, but to consider any option they could. We're unfortunately not in a position as a county to remove any of our resources to there, and so we are just looking for any avenue or method that may help folks down there maintain the integrity of their own healthcare system.
He's got a couple of follow-up questions. During your calls with the state, did they indicate what measures they are already taking regarding the border?
Well, the state, again, they took measures, already have taken measures regarding our essential healthcare workers to make sure that through a state program, all of our essential healthcare workers have an opportunity for the motel room and motel access. The state has also provided considerable help and support with the Federal Medical Center, 200-plus rooms that have been sent down here. We had the option to perhaps move those closer to the border, but the reality is our healthcare system is all interconnected, and there was already significant progress being made towards establishing that at Palomar. And we are grateful to the state of California for sending us that asset and prioritizing San Diego for that. They've also talked about things that might happen around some opportunities to disinfect or clean or potentially reuse certain respirators. Maybe we can get a priority status in that, along with consideration for everything else they're doing. And so the state has been very proactive. Again, it was much less than a week ago. We engaged them for the first time with a series of asks. We've had subsequent follow-on and calls, and they continue to not only be aware of the problem, be mindful of our concerns, but begin to take actions to help us.
And one more follow-up. Details about the 14-day quarantines for non-essential border crossing. Do we know any details?
Well, we've done that as a country already. The United States instituted that early for travelers from China, from Italy, from Iran. And so it was just consideration to extend that same thing for non-essential workers for visitors coming across from Mexico.
That completes our calls for today, but before we leave, I had a couple of things I wanted to cover. First off, I wanted to sincerely thank my colleagues on the Board of Supervisors, Supervisor Jim Desmond, Supervisor Kristen Gaspar, and Supervisor Diane Jacob, who are all, I can assure you, very busily working in their districts and working on other issues for the benefit of all the citizens of San Diego County, and I sincerely thank them for the work and effort that they're doing to help move the agenda on this very critical issue. I also wanted to remind everybody that we will not have a live media briefing either tomorrow on Saturday or on Sunday. However, our communications team will be sending out media advisories with updates. Also, please remember that you can check our special county website at coronavirus-sd.com for updated information and resources, and you can always call 211 to speak to a live person to get information. And speaking of 211, we know that the governor today in his press conference announced a new program today to deliver meals to seniors. This will be a great benefit for our seniors. People have been asked to call 211. However, 211 San Diego is still working with the state on the protocols and the details and the logistics of how this program will work. So we ask that you hold off on calling 211 on this particular issue for a couple of more days until they work out the details. I will certainly announce in an upcoming briefing when this service is available, and we sincerely thank 211 for everything that they're doing in providing reliable information to the citizens of San Diego County. We know the weather this weekend is going to be outstanding, a beautiful San Diego weekend, and you might not be able to resist the temptation to get outside, and we understand that. But if you do, please be safe. As we've said repeatedly, stay in place, maintain space, and cover your face. We'll see you Monday at 2:30. Thank you.